Hello, I am about to interview Elena Agassi, a nurse practitioner with CHS Medical, employed at Ogilvy and Mather, which is an advertising agency. Elena Agassi is a nurse practitioner. She has been a registered nurse for 7 years and a nurse practitioner for 3 years. So her total experience is 10 years. Ms. Agassi, can you please give a brief summary about your experience in the medical field?
Initially, I was working in labor and delivery for some time. Then I switched to orthopedics and worked in orthopedics for 4 years. Then I switched to ICU and worked in ICU for 3 years, and was going to nursing school for my master's. When I graduated with a master's degree in family nurse practitioner, I started working in a hospital also in oncology. Then I was offered a position here and accept this position, and I'm working for CHS and corporate health for 1 year already.
Okay. With all of the specialties or specialties that you've worked in, how often have you experienced patients that they are very unaware of the medical care that they're receiving, or even documents that they're given or having to sign that they're not really, they don't really understand the information that's given, that's being told to them, or even the information that's on paperwork?
From my experience, when I was working in a hospital, most of the time people who are in a hospital, they are in a critical situation. They're not really paying attention to all the documents they are signing or were given to them, or they just not able to concentrate precisely on the paper, and relatives who come to visit them also under stress. So many times information must be reinforced for people to understand even simple discharge instructions, and it's crucial for us. It was a part of hospital policy to call every patient who was discharged, call this patient next day to verify if they still have this information, discharge information, if they understand what it's all about, if they have questions. And every time most of the time, people were very glad what we called back, because previous day they were not concentrated on, or were unable to concentrate properly on education provided. So they definitely need us to call back, and they needed help to understand what exactly they have to do and what it's all about. Obviously, outside of the hospital situation is different, but even working for corporate health, when people come visit me, they're not in, most of them not in acute distress, they just mildly sick. I notice all the time what information provided needs to be reinforced, because as soon as people come to see a doctor, they become preoccupied with their condition, their present condition. If they would be totally fine under different circumstances and could comprehend information provided easily, when they are under stress, when their health is impaired, their judgment, their understanding a little bit different from normal circumstances, and even most educated people who, by our assumptions, should know more, should know better and understand easier, they experience difficulties with understanding information provided, and especially for whom people for whom English is not a first language, they need a little bit more help. Sometimes they even don't want to admit what they did not understand instructions or any information provided, so you have to be really, really non-judgmental and don't assume everything what you said was understood correctly, and they will follow your instructions.
Okay, thank you so much for your answer to that question. And my final question is, overall, within the hospitals and even in corporate health, what you touched on it a little bit as far as in regards to reinforcing and contacting the patients to follow up with them. But what are some other ways that you believe this issue can be resolved as far as in regards to patients being aware of their care and documents that they receive and, you know, medications and everything, that they're aware of all of this? So what ways do you feel that this can be resolved, this issue can be resolved overall in medical care?
Clinicians should be aware what there is a problem actually if person and relatives who help to take care about this person did not understand correctly what been said and what needs to be done. The health of the patient may be even in danger if they didn't understand your instructions correctly. So most hospitals already realize it, and we are trying to prevent readmission of the patients because they didn't follow instructions, because they didn't understand instructions, or they didn't realize how important it is to follow doctor's instructions. So most hospitals pay a lot of attention to tune the process toward patients' needs. And outside of the hospital and private practice, I think the most important moment is for patients to be able to contact provider easy, and at least when they're in an office, it should be reinforced, but you definitely can call me with questions. Please contact us with questions. When they're gonna come home, when they will come home and relax, and they will realize what they didn't understand, what needs to be done. They have to feel comfortable to call provider back to clarify information.
Okay. So again, I am speaking with Elena Agassi, who is the nurse practitioner here at Ogilvy and Mather, an employee of CHS Medical. Again, I thank you, Elena Agassi, for taking the time out to do this interview with me, and thanks again.